Welcome back to Preserve Health Talks. I'm Dr. Ira with my co-host Leah again. And it's been a few weeks, but we're here back in the studio this morning with Danielle Lea, the founder of Momentum Integrative Health Solutions. And the way she describes it is she's helping people build their best life. Good morning.
Good morning.
How are you?
Thanks for having me. Great.
Yeah, great. So let's talk about what you do and why you do it. And you spent nearly 2 decades in the pharmaceutical industry before transitioning into what I'd like to call health optimization. So what was your turning point that inspired that shift for you?
You know what's so interesting is when you spend time in the healthcare world, in the medical world, and you really get that peek behind the curtain, and you get a really good appreciation for the stuff that you as doctors and providers have to deal with, a lot of the red tape. And we see it from a different perspective from the pharmaceutical industry. And when I left that industry, I left that to go build the It Didn't Crush Me brand. And that means exactly what it sounds like to you. It should take you back to a moment in time where you were running on faith and fumes, and you have to dig into resilience to try to recreate something in your life or some part of your life. And I spent the last 7 years working through that, taking people on this journey from resilience kind of into surrender. And when you come out of that journey and you realize you've burned for this life, you've bled, you've done the hard, like, wow, look who I've really become, look at the life that I've built. And you kind of look down and you're like, my body, I have all this knowledge, I love my life, and my body's holding me back. Like, this is not okay. And so I was able to take everything that I've learned and seen and look at the gaps. And I think we're at a very pivotal time right now with a lot of the changes going on societal wise and in the healthcare system with trying to redirect health. And I really want to empower people to take their health into their own hands and not rely on someone like a medical professional to be the entire controller of our health. That is our job. And so we do a lot of education, empowerment, and we teach people strategies for resilience, but also to live longer, to feel better, to have more energy, and to really just live life. And this is kind of my nerdy side coming out. Two standard deviations to the right of the bell curve. Like, don't want to be average. I want to be extra.
Yeah, I think that's fascinating, particularly coming from the pharmaceutical industry, because the way doctors are trained is we treat illness, but we really don't make people more resilient. We don't help people necessarily live their best lives. And I'm sure as our show goes on this morning, you're going to tell people what you do and how you do that. But thank you again for being here.
Absolutely.
Yeah.
So Momentum is built on merging science, strategy, and soul. How do you bring those 3 elements together when working with clients?
Well, we will start with either a 30 or a 60-minute consult. And you can find out a lot when you allow people to talk and you ask them questions. And what are their goals? And then what goals do they have for their life besides, based on like what their actual life is? Are their goals in alignment with their current situation? And how do we make them feel better? Do they need more energy? Do they need to lose weight? Are they really looking to be more active? I don't work with somebody who tends to be ill or in dis-ease. I take somebody who really loves prevention over prescription, unless of course that prescription's for peptides. So.
Right. Well, that's a whole interesting concept because the word disease actually is 2 words, dis-ease. So people are ill at ease and that makes them sick. So people feel overwhelmed today by a lot of conflicting health advice in the community. It's coming from all angles. So what's one principle you believe everyone should start with? The starting thing that you do to improve vitality and longevity?
I think we have to start with being real with ourselves. What's a realistic expectation for what we want our life to look like? And again, do those goals match our current situation? And getting them to see, okay, we might want to go toxin free. We might want to move out to a farm and raise our animals and eat the fresh grass-fed antibiotic-free beef. But if you're living a life where you've got kids in soccer and your parents are in a nursing home and life is chaotic and crazy. Is that a realistic expectation for you? And are you sitting there beating yourself up for it? What's a change that we can make? Does it need to start with the food that you're eating? Does it need to start with giving you more energy? And so it really boils down to the first starting point is getting honest with ourselves. That's why I really prefer to spend the first hour with somebody instead of just 30 minutes. 30 minutes, we can get them a quick solution. 1 hour gets them a solution that's really going to impact their life because they're going to be honest with where they
But
want to
that's
go.
got to be such a challenge because you're dealing with a society that's stressed out. Mom's taking kids to soccer, all these different type of practices, all these extracurricular activities. Parents are stressed out. You're dealing with two-job family, no time to exercise. Mom's 40 to 50 pounds overweight. To help her out through the day, she pops a few Xanax throughout the day. And I don't have time to cook, so I'm going to take the kids to McDonald's. How do you deal with that?
I love to educate people on the value and the benefits of GLP-1s. And this is a really hot topic, but when prescribed by a medical provider for medical necessity, when given the right expectations and setting someone up with the expectation of, in the first 3 months, I want you to be gentle with yourself. I don't want you making all of these changes. The GLP-1 is going to turn off a lot of that food noise. It's going to help calm down your cortisol. It's going to turn off the food noise. It's going to allow you to start to rebuild a relationship with yourself. So month 1 of, if you are deemed appropriate for a GLP-1 for medical weight loss, month 1, I will have you do 3 things. We're going to focus on your rest. Please rest. Allow yourself that rest. Sleep is so important for our entire longevity. Number 2, we're really going to pump liquids. Lots and lots of water, lots of electrolytes. And number 3, I want you to think about eating, because when you start these products, you're not going to be as hungry. So let's make sure that you don't go 8-10 hours without food. Let's think about putting food. Month 2 and 3, we'll start thinking about which food you start to put into your body. But month 1, be gentle, get to reintroduce how you feel, how you're going about your day. Notice how the medicine's working in your body, and be mindful of that rest, that water, and that food.
Okay, so that's the pharmaceutical part of it, but there's got to be a huge psychological component to it all as well. How do you balance the two, and what do you do to provide them with that psychological approach to leading their best life?
The people that come to me are truly saying, like, listen, I'm trying to do all the things. I'm spending some time working out and nothing's changing my body. I'm conscious about my food. Now, granted, during that 60-minute consult, you hear, well, we only have ice cream a couple times a week, or this or that, right? Those things slip in. But you get to a point in life where hormones start to change, your body starts to change, and it just does not respond the way it did when you were younger. It's part of the blessing of aging. But we've realized we get to this point where we have all this wisdom and we love our life, but our body doesn't respond the same way. And so understanding that if we continue to do the same things that we've always done, and we don't introduce something different, we don't think about those hormones, we don't do something to activate our body from the inside out. I like to say, I try to get your body working with you instead of against you. And so I like to hear what it is that they're doing. They always recognize there's been a shift. They always want to be more active. They want to be more healthy. But when you continue to try and you don't see the result, it is really frustrating. And that's where most of us just throw in the towel.
So there's a lot of buzz around peptides and GLP-1s, but there's also a lot of misuse, which we've seen in our practice. What should both patients and providers understand to use these therapies safely and effectively? I've had patients come to me who are getting them just from some random online company without seeing a provider. So there's definitely been a shift.
I'm glad you bring this up, because I think that the peptide market, and again, people say peptide is the latest buzzword. Peptides is a scientific molecule in your body, right? It's a little messenger who signals your body to do something that it's supposed to be doing. And I really just tell people, when you introduce a peptide into your body, it knows what to do because it naturally makes peptides. We just make less of it. So when you take this approach, people get really excited because it's almost like hitting the easy button. But that means now you've opened up this entire world online where there's this almost black market, like, for these peptides. So we do a lot of education. There's research grade peptides, which I tell people run from. It literally says on the website, and I have people that come to me and they've used this too, not for human consumption, only for use for research, and they're still injecting it because they're desperate. Number 2, there's a lot of variance between compounding pharmacies in the end formulation, right? Compounding pharmacies, they're highly regulated, but when it comes down to physically watching and seeing those processes in the pharmacy, there's a lot of room for human error. We're doing some chemistry, and although there's regulations and standards, 90% of compounding pharmacies do not pass third-party testing. And so when you're getting patients who are having complications, they're having injection site reactions, they're having a lot of side effects, there's a couple of things that can happen. Either they're getting a product that is not at max potency as it should be, or it's been slightly compromised due to storage or overall humidity, moisture in the air where it was being kept, not in the proper chain of command upon delivery, or potentially it could be contaminated product. But the other piece is they're not getting their hand held, they're not told the expectation, and people themselves are not, they're either overdosing, dosing too often, not supporting their body nutritionally. It's so important to hydrate, and it's so important to think about things like that gastric emptying, because you can have a lot of blockage in the stomach. And I know that we hear a lot about that, but I do think a lot of it comes from people who are not guided by a medical professional. When they come to us, they are assessed for medical appropriateness for the particular peptide, for the particular medication, based on a medical history form. And that allows our telehealth team to decide if this is appropriate for you. Then they will be reassessed every 3 months if it's GLP-1, or as needed every time they order a different peptide. But I personally provide a lot of coaching in terms of what the expectation should be, how you need to support your body, things to do, things not to do. People just don't know when they get their medicine in the mail and there's very little instruction. If you don't have a support team with you, this is what happens. People stay on the medicine too long. They don't nourish their body. They get Ozempic face. They get weak. They get malnourished. And then we see all the side effects.
So you're kind of like a bridge. We're allopathic providers over here, and then they're functional medicine specialists over there. And you kind of are kind of like they're bridging the two with regenerative therapies and peptides. And for our audience who might not know what peptides are, give us a brief explanation, very brief, of what peptides are and what they do for the body.
So peptides are little messengers. They're signalers inside of our body. We naturally make them, but they tell your body to do something. Insulin itself is a peptide, probably one of the most common ones that we're used to seeing. So when your body is introduced to a peptide, it's almost like going back to a college reunion with a bunch of people that you are excited to see. You inject a peptide, which is the most efficacious way to receive it. Those powdery potions that are mixed in fun little drinks and packets, we all know that they really don't do anything. They're selling you hope in a bottle. But when you receive that peptide through your through the injection, your body literally knows exactly what to do, and that's why you see the benefit come so quick. You should notice a benefit, a change in your body within the first 2 weeks. And that's it. It's very simple.
So, in your experience, what's one habit that consistently separates patients who thrive from those who plateau?
Support and their realistic expectations, right? And again, this is what you attract, right? I attract people who want to do better. They know the things, their body's working against them. They really have this desire to live long and live healthy. But when you provide their body with that one little piece that's kind of missing, and now it unlocks the keys to, they started to lose weight, then they started to feel better. So then they started to move their body. It's like when you get in midlife, I think one of the things is, what did you do first? Did you pick up the weighted vest? Did you pick up the sourdough recipe? Did you start playing pickleball? When you see someone who has those desires, right, but yet recovery takes longer, if you have a support system to know, like, this is normal and these are the things I can do to combat them, you will be much more compliant with your medication, with your peptides, whatever. And that support, it does lack in your industry, truly, right? You are taxed seeing X amount of people every single day. They walk out. You tell them what to do. It's overwhelming at the doctor's office. You really need kind of that conduit, that coach, and you need community as well. That will keep people successful.
So let's get down to how this actually works. People call you. The number is going to come up on the screen in just a second. They'll call Danielle Lea at Momentum Integrative Health Solutions. You'll speak to them 30 minutes, 60 minutes. You make recommendations, and then what? What happens from that point on?
So while I'm not technically giving medical advice, I'm not a licensed practitioner, but I do know my way around the human body, and I am a GLP-1 and peptide educator, right? So I will tell you what it's supposed to do in your body. You will be assessed. So first you book the call with us. You can also take a quiz. It's a metabolic health quiz right on the homepage of our website, momentumintegrativehealth.com, and find out things about your energy, whether you really want to burn fat, whatever that is. And we'll give you a solution there. So if you want to book a call with me, I love to spend that hour with you. Then I will help you decide what we together feels the best for your goals, but where you are in life, make those recommendations, and then you will be assessed through one of our telehealth doctors if you go the prescription peptide route. And then that medication will literally be at your door within the week with the proper instructions, and then you will have the ability to follow up through me. But any medical questions that arise while you are on your prescription peptide or your medical GLP-1, you have a telehealth portal. So you have access, right? We want GLP-1s in your system for a minimum of 90 days. And certain peptides would cycle 8 weeks, maybe 12 weeks. So for the cycle of that particular peptide, you have access to your telehealth doctor to ask those questions. You can dose down with your GLP-1s. A lot of people love to microdose. Microdosing provides cardiovascular benefits, neuroprotective benefits, bone density protection benefits. And there's so many people who, beyond weight loss, once they get to their goal physique, they continue to microdose for those long-term benefits. It also balances out your insulin. So you have those questions. Hey, doc, this is my prescription. Can I take less? Can I take less? You're welcome to slide that question right through the telehealth portal as well.
That's great.
It almost makes your guys' job easier, right?
Yeah.
Like, how much,
Yeah.
can I ask you a question?
Yeah.
How much of a pain sometimes is it when you have weight loss clients?
Honestly, we're in concierge medicine, so we're not really taking a traditional approach. So we're able to bring patients back pretty quickly to reassess them. A lot of the times, though, our patients come with us with other comorbidities, right? So we're managing hypertension, diabetes. So we do see a lot of benefit from GLP-1s, but we're not necessarily tailored to just medical weight loss. Of course, we take into account like BMI, hypertension, all those sorts of things, and we can treat them accordingly. But I think having that additional support, along with like nutrition and things like that, we like to bring in other people.
Right. And I think the advantage of a practice like ours is it's not a quick 15-minute visit, 30 minutes, 60 minutes if they need it. So we're very supportive of our patients, as you are of your clients. Well, I'll ask one last question then. Okay. Which biomarker do you think is most overlooked but critical for long-term vitality?
Well, I'm so glad you actually asked that. I think the most underrated...
I had to recover from the question that was already asked.
The most underrated thing, in my opinion, and I find it to, I like to say, like, this is probably the most, or the least sexy part of the body to talk about, your omega-3 levels. One of the foundational pieces of our nutritional program, and once someone's been on a GLP-1 in their first couple of months, I want to get their omega-6 to 3 ratio back into balance. And most people, when tested, the average American is about 25 to 1, 25 omega-6s to only 1 omega-3. You want to be at 3 to 1. What does that do? That balances out that cellular rigidity so that you can actually get the signals in. The cells can do what it needs. It can get the messages back out. So cellular rigidity, and this is also a key marker of inflammation. Chronic inflammation, is the foundation of all of our major diseases. So I really like to ensure that we bring down the omega-6, drive up the omega-3, and we do that specifically through a dry blood spot test. We send that out, we test you at baseline, give you a product to take for 4 months. We'll retest you for free to show you that it's actually doing in your body what we say it's going to do, because the supplement industry is wonky at best. That's probably the nicest way I could say it. And then you see that 95% of the time, the people who have taken this Mediterranean diet in a bottle, this balance oil, they come back into balance in that 4-month period at 3 to 1.
That's super. We're kind of out of time, but it's been a pleasure. It goes fast. The show goes fast.
Absolutely. Thank you so much for having me.
Come back and let us know how you're doing in the future. And thanks for being here.
Absolutely. Thanks so much.
This has been another episode of Preserve Health Talks, and we'll see you on our next episode.